else do you guys want to say while I'm speaking? Yes, person.
Amazing. So good evening, everyone, and welcome to the MIT 100K Accelerate. Yes. Awesome. Thank you so much for joining us tonight. I'm Celine, and I'm the managing director for this year's 100K, and I'm joined by my fellow managing directors, Taylor and Jayshree. We're really excited to have you join us, both in person here and wherever you might be in the world looking through our live stream. For those of you who aren't familiar, the MIT 100K competition started over 30 years ago when a group of students partnered with Professor MIT Ed Roberts to bring the school's Mens Humanis motto to life through a startup competition. With Ed's help, they raised 10K. That generous amount actually sparked an entrepreneurial movement that's only grown since. Thanks to our generous sponsors, that amount grew to 50K and now is 100K for the prize that we know today.
Of course, this is made possible by all of our incredible sponsors. First, we'd like to thank Akamai, our presenting sponsor. For those of you who don't know, Akamai actually competed in 1998 of the 100K competition. It is one of our greatest success stories to date. Thank you for paying your success forward and enabling young entrepreneurs to achieve their dreams. We'd also like to thank our newest sponsor, Goodwin, for sponsoring this year's competition. Headquartered in Boston, Goodwin is a leading global law firm with deep expertise within the innovation and entrepreneurship ecosystem. The firm partners with founders, investors, and high-growth companies at every stage of their journey, and its commitment to supporting emerging ventures makes Goodwin a natural fit for this competition. And finally, a heartfelt thank you to the Morgenthaler Foundation. In honor of the late David Morgenthaler, an MIT alum and true champion of entrepreneurship, they've not only sustained but also increased their sponsorship this year, deepening their impact to MIT's startup ecosystem. The funding all sponsors and partners have provided us enable us to have this competition tonight and provide the prize money for the MIT 100K. In addition to their support, our partners serve as mentors and guides for our teams and our organizing committee members.
And of course, this competition was made possible by our judges, starting with our preliminary round of over 60 judges who brought a variety of experiences and professional backgrounds to the competition. They each volunteered their time, reviewing applications and providing crucial feedback to ensure the competition's fairness. Tonight, we are also thrilled to be joined by our esteemed panel of judges. First up, we have Zan Ali. Zan is a partner at 2048 Ventures. His prior experiences includes working with the chief investment and operating officers at Putnam Investments on investments and special projects. Prior to Putnam, Zan spent 4 years at Fidelity Investments, where he was on the internal strategy team and helped launch the insurtech startup Fidelity Health. At MIT, he was a pre-seed investor with the Dorm Room Fund and served on the teaching team for the Venture Capital course. Zan holds a Bachelor in Science in Statistics and Finance from Babson College and an MBA from MIT Sloan School of Management. We are also thrilled to have Jifei Wu. Jifei is the founder and the CEO of OPT Industries, a digital manufacturing company building scalable production for medical devices, consumer goods, and electronics. Before founding OPT, he graduated from the MIT Media Lab, where his research focused on computational design and digital fabrication.
Up next is Mark Legare. Mark is a principal at InnoSpark Ventures, where he focuses on digital health and tech-enabled services. Mark has been with InnoSpark since its founding in 2019. Prior to that, he served as a senior special assistant and personal aide to Massachusetts Governor Charlie Baker. Mark began his career working in equity research at Morgan Stanley. Next up, we have Joël Lerere. Joël Lerere is a partner in Goodwin's technology company's intellectual property practice group, focusing on the strategic development and protection of IP portfolios and related transaction. His practice encompasses both domestic and international patents and trademarks, with significant experience in prosecuting patents for software and e-commerce. He advises clients on IP licensing, open source issues, and due diligence for MAs, IPOs, and venture capital transactions. Last but not least, we have Carolina Goncebat. Carolina Goncebat is the founder of MyPhoenix, an AI-powered bilingual companion that helps young children learn a second language through daily conversation. She previously co-founded and served as CEO and CRO of BetterVet, where she helped scale the company to approximately $40 million in revenue. Carolina holds also an MBA from MIT Sloan.
And finally, we want to thank everyone on our MIT 100K organizing committee. We truly could not have done this tonight without you. The members have invested countless hours to ensure that 100K is a success. Without them, none of this would be possible. We also want to recognize our audio and video production up there, to teams which have been super helpful in enabling this hybrid event with both in-person and live stream options. We want to take a moment also to express our deep gratitude to the outgoing directors, Supriya, Christina, and William. Your enthusiasm, commitment, and unwavering support have been invaluable to the success of the 100K. Thank you for your leadership and dedication to the entrepreneurial community at MIT. Now let's get to the main event. In February, nearly 95 teams applied to compete in tonight's event, and our network of external judges reviewed each application in the preliminary round. This evening, the top 9 teams will compete for a grand prize of $10,000, the second place prize of $3,000, third place prize of $1,000, and the Audience Choice Award of $1,000. We'll start off with a 3-minute pitch from our 9 finalists to give you an overview of their exciting ventures that they've been working on. Then each finalist will take 5 minutes of questioning for our illustrious judge team to dive into their ideas. After that, you will have a chance to engage with our competitors and eat dinner out in the foyer. So we encourage our audience members to ask questions to learn more about what the teams have been working on and building. Once you have heard from the teams, we'll come back inside and you can vote to determine who will win the $1,000 Audience Choice Award. To all of our competitors tonight, we wish you the best of luck. I know you got this. And to our audience, thanks for tuning in. Please sit back and enjoy the show. Now let's get to the pitches.
Our first pitch of the night comes from Cerberus AI. Cerberus AI secures modern software and AI systems by integrating directly into applications to detect and stop threats that bypass traditional firewalls. Good luck.
Hi, we're Cerberus AI, and we're securing API infrastructure for the agentic future. Today's cybersecurity tools primarily look at individual events and behaviors, but they do not look at the total sequence of user interactions to determine the intent behind those actions. And this is a huge problem, because API traffic already represents 71% of all internet traffic. And API-related breaches cost tens of billions of dollars every year. And this problem is poised to explode as agentic AI drives up to 100x increase in traffic to APIs. And we're already seeing this problem emerging in the headlines, including with everyone's favorite viral AI agent and every security engineer's worst nightmare, OpenClaw. That's why we're building Cerberus AI, the trust layer for agentic systems. Cerberus AI installs directly into your API applications, monitors all interactions, whether they come from humans or agents, identifies suspicious activity and attacks, and defends your systems. We do this through 3 key pillars. The first is collaborative threat intelligence. We leverage the network across all of our clients to defend everyone in the system. Second is intent-based analysis. We leverage the latest machine learning techniques to find, identify, and stop cyber attacks and fraud. And lastly is our flexible response system that allows you to determine how your business is going to respond to threats. We're starting with mid-market financial services. Why? Because they face huge exposure and large regulatory requirements, but often have deeply stretched application security teams. And we're excited to announce that we've just signed our first LOI for a paid pilot with a major financial institution. But that's just the start. This is a huge market and growing fast. API and AI security is more than $10 billion and growing at more than 20% every year. And we ultimately see ourselves playing in the massive anti-fraud market. I'm Griff, and before coming to MIT, I was a senior software engineer at Tesla Autopilot. And with me today is my co-founder, Sarah, a Navy vet with extensive experience in cyber operations. And we're Cerberus AI.
I'll start, I guess.
Shoot.
So first question, you mentioned kind of cross-client data sharing and learning. So one of the biggest issues that I run across as a licensing attorney in the AI space is companies not wanting to do exactly that, right? If I'm Fidelity, for example, I do not want Putnam learning from my data, or your model learning from my data. I want that completely walled off. Have you thought about the different business models that might implement? Or
Yeah, definitely.
Yeah, I think it's kind of twofold. So one place where we've actually had a lot of luck where this idea of sharing information is really important is actually in credit unions. And so that's actually where we have our first pilot from, is a large credit union. And so it's very exciting to them because from a fraud perspective, it's almost necessary to do some level of sharing. But the way that we're doing it so that it's secure in a way that isn't necessarily sharing that raw data is it's pseudo-anonymized.
How did you, so for your the first beachhead market, how did you make that decision? What are other areas you looked for, and how did you come to that?
Yeah, it's a really great question because this problem is cross-industry. And so we did think about things like e-commerce and fintechs. We actually ran a test in December, and we simply were just doing cold outreach on LinkedIn to test different groups to see who was the most responsive. And interestingly enough, it was the credit unions who tended to chime in the most. So we focused there first.
But ultimately, we see this problem cutting across a lot of different markets. So SaaS, e-commerce, eventually health, but starting in financial services.
Can you guys touch a bit more on, after you do some of the threat detection and work around when, I guess, the APIs are being used when they shouldn't be being used, what happens next? How should we think about the remediation piece in all of this?
Yeah, I think that's a really great question because this is a big gap with a lot of competitors, and like all they can do is allow or block or maybe some very basic friction. But ultimately what we found is that what you want to do is very like business dependent. Sometimes it's you want to alert a certain team, put it in a queue, change a block list, alert a Slack channel. And so we're building tools that allow you to define like what is that workflow that gets triggered after an alert happens. And I think that's also very exciting to our clients because false positives are really bad in this space.
And have you started with an initial kind of threat model or threat data set that you're using that you've licensed from somewhere, or are you building that up organically? Where are you kind of starting with that?
Yeah, so we're going to get a lot of that initial data from this first pilot partnership. That's why we've been pursuing this pilot model, is that we're going to be able to iterate a lot with those pilot partners to get data and build out more sophisticated models. And then in order to kind of deliver value right away, we're able to build systems for cataloging all their APIs, compliance of those APIs, certain types of attacks that we can detect with more rules-based or statistical techniques, and then as we get more data, moving into more machine learning-based models.
And what's your plan to validate more in the financial services that you are working on right now? Like you have one customer who's interested in, how do you know if this is a false positive? Like, yeah.
Yeah, I think it's a really good question. We do have a little bit more traction, of course, because we've continued to explore. One thing that's interesting about credit unions is that they actually have these sort of communities inherently. And so, for example, later in this month, we're actually meeting with like a larger group. And so that, I think, will be a really good way to test if this is probably like the best beachhead market. And then we are interested in testing those others too, but where we are right now supporting this larger pilot, hopefully we can expand.
I guess one more for you guys. So help me understand, like, I guess the most common attack surfaces through APIs for these credit unions. And I guess when I think about the world of like agentic kind of finance, I guess, what are the attack surfaces that you feel like are most omnipresent for these credit unions?
Yeah, so this is great. I have an appendix slide for this. Hang on, here we go. So a couple of things. The first category would be your typical like OWASP top 10 type vulnerabilities. Those I think we can address in a lot of cases without even needing particularly sophisticated machine learning models. But on top of that, you have how can we use this behavioral and intent-based analysis to find reconnaissance early on, account takeovers, compromised AI agents. A huge part of our thesis is that AI agents are going to get our keys to do a lot of things on our behalf, and they can do a lot of damage if they become compromised, even doing things that they're authorized to do. If your AI agent is authorized to use your bank account, but it gets compromised and sends all your money somewhere, that's an action that is authorized by policy, but obviously very bad. So we have to do it from this behavioral and intent-based analysis.
Awesome. Thank you so much. Next up, we have Trial IQ. Trial IQ builds health-grade AI voice agents to deliver 24/7 empathetic patient communication.
I'm a physician at Harvard, and one of the hardest parts of my job is not treating patients. It's telling them that a life-saving therapy is available, but they can't have it because it's stuck in a clinical trial. Imagine you're watching a movie on Netflix, but I told you you could only see the first 5 minutes and the last 5 minutes. Would you understand what's going on? That's what happens in clinical trials today. A patient is enrolled in an experimental drug on day 1, but they don't see their doctor for another 90 days. And then they're asked to recount all of their health information for those 90 days. We call this problem the 90-day black box. And why does this happen? Because a $100 billion clinical trial market runs on phone calls and voicemails. The end result, when these phone calls don't happen, data goes missing. Billions in losses occur, trials are delayed, and life-saving therapies don't reach our loved ones. We're solving this today with Trial IQ. We've built agentic voice AI that's medical grade that can conduct structured phone calls with patients in a protocol-compliant manner. It can collect missing data, it can report safety, and most importantly, it can escalate to a human when it needs to. The end result, trials have data they need to complete and are more likely to succeed. We have a prototype that's ready to go. We've been incubated in multiple programs across Harvard and MIT. We have 2 potential pilots with access to thousands of patients, and we're built by doctors for doctors. We're a team of Harvard and MIT cardiologists and AI scientists. We're both technical and medically oriented. We have clinical trial experience and AI experience. But let's show you what we're actually building.
Hello?
Hello, my name is Alex. Am I speaking to Arash Nargisi?
That's me.
I am an AI assistant calling from the Clinical Trial Center for the Obesity Research Study. Is now a good time to chat?
Yes, we can.
How have you been feeling overall since our last call?
I'm fine. The only problem is that there was a snowstorm in Boston.
I'm glad to hear you are doing well, though a snowstorm certainly sounds like a lot to deal with. Hopefully you are staying warm and safe. Have you been taking the study medication every day?
Yeah, I have.
Have you experienced any side effect of Ozempic, such as nausea, vomiting, or abdominal pain?
I've been feeling a little nauseous, but nothing crazy.
I'm sorry to hear you've been feeling a bit nauseous, but I'm glad it hasn't been too severe. Have you been hospitalized for any reason in the past month?
No, I have not.
So we're solving the problem of clinical trials being inefficient, expensive, and slow with voice AI. We're Trial IQ. Thank you.
Would love to hop into what we can frame as the causation correlation question here and help us think through why patients don't stay through the course of a clinical trial. Because I think that maybe communication plays a role, but I don't know if it plays the full role. And so when we look at issues like patient adherence, it's medication adherence, it's driving to a trial site, it's multiple forms of communication, it's human behavior, and it's really hard to solve. And so, love the mission, but trying to get a sense of causation correlation, and is communication the issue, or is it something a little more human, a little more complex, and a little more onerous for patients to go through?
That's an excellent question. So, we're definitely not going to be able to solve every problem in clinical trials. That we're going to say up front. There's a big $100 billion market there that has a lot of issues. But what we can do is improve that human aspect that you speak of. So a patient may not be adherent to their medication, but there could be a variety of reasons. Maybe they had a wedding they attended to, maybe they didn't get a refill, or they didn't have transportation. These are the kind of questions that our system can be tailored to ask. They can ask open-ended questions. They can really kind of dig into what's happening. And what we tell a lot of our potential customers is that we give them a ground truth, like the ability to talk with a human, get a medical grade transcript to try to understand what is happening on the individual level. So it's an excellent question, and there's definitely a lot of the human aspects that need to be fixed, and we're just trying to build a piece to better understand that human aspect.
Have you tried this out with different population metrics? Elderly people that might be agent, or people that, English isn't their first language, or anything like that?
It's a great question. So the first thing is the system is multilingual. It can handle over 20 languages, which we see as kind of one of the strengths of this type of technology. The second is that not every person will be willing to engage with AI. There's no doubt in that. So there will be some patients who will not accept this phone call. But there's been good data in the literature that's shown that about 65% of older patients are willing to engage with this type of technology. And paradoxically, at least to us, older population actually prefers phone calls instead of text messages and emails. So they actually have a higher rate of usage than we had expected based on the literature.
What's the next thing you want to validate? Like, you build a working prototype. Do you want to give more people to test? What's the plan?
So we're working on finalizing 2 design partnerships, and basically what we're using that for is to develop those key performance metrics that we need to further sell the product. And so what those metrics will be some of those kind of metrics, like how many patients are engaging with the AI system. Does this reduce loss to follow-up in the clinical trial? Does this actually provide additional missing data that clinical trials don't normally have? And so one of the ways that we're testing this is we're trying to design this in a randomized fashion within a clinical trial. So those with AI and those without, to try to get some of those metrics.
Is the economic buyer for this the CRO or the trial site themselves?
So we're focusing on the CRO and the sponsor specifically, and not the trial site. A variety of reasons for that, but in brief, for the CRO, it helps them with their day-to-day operations. It helps them actually differentiate from other potential CROs. For the sponsor, it gets that ground truth of a trial, which is what they really want, is like, why is the patient not adherent to the therapy? Like, what's going wrong there? Implementing it having it at each site is challenging because in phase 3 trials you might have 120 sites. So trying to sell it to 120 sites is much more difficult than selling it as a package to a CRO or a sponsor. So a couple different factors there. So one is that we're both cardiologists, so this is protocol customized for the clinical trial. So it's not something that someone without that experience can't build in. The second is that we are one of the first in the market, and so we'll be able to develop these KPIs before others. And then the third is that once you implement into trials, we're actually going to scale this into a larger kind of vision, which is a trial operating system that's AI forward. So our wedge is voice agentic AI, but the bigger vision is a AI system or trial operating system that runs on AI.
Awesome. Thank you so much. Next up is Mendai Health, an AI-powered, fully digital maternal care and rehab platform delivering care from pregnancy through to early perimenopause.
Mendai Health is a maternal recovery and rehabilitation platform. Hi. My name is Anshul. I'm an orthopedic turned women's health physical therapist with 20 years in clinical and hospital operations, a mom of 2 little girls, and proud Sloan MBA. Across both the pregnancies, I turned from CrossFitter to can't lift. I was cleared at 6 weeks postpartum, and I was still in severe pain, leaking, and couldn't lift, had bad anxiety. Turns out that this is not just the problem I had. Over 40 million women suffer from this problem. OBGYNs, they do a wonderful job of keeping moms and babies medically safe. But the problem is the day-to-day guidance that keeps mom moving, heal, and progress from during pregnancy and postpartum. When the symptoms exist, women are referred to women's health physical therapy and rehabilitation. But the problem is long wait times of months and no continuity of care. And that is exactly the gap that Mendai fills, where we provide rehab-led clinical extender to our OBG teams in the hospital, providing women support from early pregnancy into postpartum and perimenopause, preventing and treating the symptoms early, providing the support with labor and delivery, and faster recovery postpartum so they can feel like themselves. Maternal hospitals are closing. OB shortages are growing. Maternity deserts are becoming massive. And the problem is and healthcare system needs a scalable OB clinical extender model. Our HIPAA compliant app, where the OB refers the patient, triages the mom, assigns into the clinical pathway, and provides the end-to-end support with the rehab clinician, and does the progress tracking and escalates any issues as fast as possible to their referring clinicians. We have huge traction. We are already in the market, shaped by over 200 moms and 30 plus clinicians and researchers who has helped shape the model. And we are in live active pilot with 3 hospitals in Boston health system across different payer mixes. And we are very, very excited from the feedback from the pilots that we are getting, where our patients and our doctors feel empowered already. A lot of solutions are pointed and do education. But where Mendai differs is because of the closed loop coordination with OB, where maternal rehab becomes a standard of care, not an afterthought. This is our wonderful team, and with support today, we are looking to expand our clinical capacity to prove the outcome and make integration with health systems. So if you're excited, please join the team and scan the QR code. Thank you. I would like to have Richa join me.
Have you thought at all about, I mean, it seems like you've got some pilots, which is great, in terms of just overall kind of building trust within the community and maybe using social networking or some sort of endorsement to get traction. I know a lot of these apps and a lot of these platforms need that kind of boost to get from the 200 user to the 200,000 user level.
Yes. That's a great question, but because of my clinical expertise and big network, we are targeting hospitals first. And in parallel to your question, we've started a social media channel. We have started the awareness. But thanks to the existing social media influencers from the space, they're doing the job for us.
Question on the business model, because when we think about the pathways you can take, because this population is not recurring for maybe a long time, they're activated in this precise maternal window. I think going to consumer would be expensive because you'd be paying for ads, then you'd keeping them for a short amount of time, then you'd be constantly replacing the top of the funnel. But then hospitals are hard too, because right now, federal funding is being cut, hospital budgets are being stripped away, there are internal innovation departments, and you can tell me, yeah, but we have 3 pilots, which is really impressive. But I guess it's a long way to get to a question of why not go to the payers? Because if you can reduce costs by avoiding expensive events that may or may not happen, they could be the ones who would be the most to gain. Because it's hard for me to imagine a business where you can charge on a per patient basis and generate a big business, but why not go for payers?
That's a great question. First of all, this problem doesn't stay in the maternal population. So 1 in 3 women are impacted by what we are doing right now, and why we are starting here is because this problem continues to get worse as women age, and the prevalence is higher. It gets to 1 in 2 women who have this problem. And hospitals, so when we were doing our primary market research as we were building, what we realized is hospitals are actually looking to create this value in the hospital, starting with making this a standard of care and offer as the value-based to their patients.
Are there specific CPT codes you guys are going after for this? And how should we think about, I guess, the reimbursement model, speaking of payers today?
There are already existing CPT codes that we'll be using, but our goal is not one patient or PM, but the goal would be that once we are able to prove out this model in the hospitals, we create value for them, hospitals would pay us directly as a population pricing versus PM.
Yeah, maybe on this topic. So then what's the single metric you think that hospitals care most about when it comes to this?
Access and continuity of care. So Access right now, their patients have up to a year wait, and that's why we got into the pilots so soon, because the moment I talked to the chairs of the departments, they were just like, yes, our wait is up to a year. We have the department, we need this and we want this, so we are willing to try.
Awesome. Thank you so much. Okay. Amazing. So next up we have Angy. Angy is an AI clinical manager built for independent physicians in emerging markets, building the operating system for scalable modern healthcare.
Almost 1 million private doctors in Latin America. Zero infrastructure built for them. We are Angy. Thank you. Okay. Thank you. In the US, healthcare runs on infrastructure like Epic, built for centralized hospitals. In Latin America, care is primarily delivered by private practice doctors, decentralized, fragmented, and no infrastructure built for that model. We spoke with more than 50 physicians, almost no one using tools more advanced than WhatsApp, Excel, pen and paper. Result, up to 30% of their time lost to admin. 1 in 2 report burnout. This is not about inefficiency. This is unbuilt infrastructure. And that's why we're building Angy, the system that runs a clinic's operations, so the doctor doesn't have to. Scheduling, documentation, follow-ups, reminders. Built around doctor and patient behavior, not hospital bureaucracy. In autonomous clinics, visits are recorded, notes generated instantly, follow-ups scheduled immediately, billing tracked in one system. Nothing falls through. Doctors get their time back, and patients get continuous care. Our beachhead is private practice specialists in Mexico. That's a $130 million immediate opportunity. Across Latin America, it's more than $2 billion, and it's growing 20% year over year.
And we are already started. Our entry point is Angy Voice. We are where the pain is the highest, where the physician makes to do a lot of documentation. We already have 2 co-designed pilots in Mexico City to make this a reality. Our traction beyond the pilots is that we are already building the technology and we are securing our commercial partners. Our go-to-market strategy, it's already in place. We have already access to 600 physicians in Mexico City. Our business model is clear, $300 per month per clinic. I'm Nestor Esquivel. I came from a family of physicians, my dad, my sister. And the last year, I had to handle my dad's surgery. And by firsthand, I experienced all the inefficiencies of the healthcare system. I not accept that reality. And that is the experience that Caro and Atahan have faced. And that's we are going together to build Angy. And we are the right team to make this a reality. Atahan will bring agentic technology to the table. Caro, it's an expert in healthcare operations. And I have been leading teams and scaling in Latin America. We have one mission. We are on a mission to redesign the future of healthcare in LATAM and in the world. We are looking for strategic advisors that have built technology at a scale and engineers that really want to solve the hardest problems in Latin America. Thank you.
How should we think about go-to-market in a fragmented space where you're selling, is it small clinic by small clinic by small clinic? So how does that scale, particularly if your biggest competitor is in a bridge, but pen, paper, and Excel?
Yes. We have 3 stages for that answer. The first part, we are starting our pilots in a very dense areas in Mexico City, but we can spread with word of mouth, which is the first part. Second, our immediate network have access to 600 physicians. We are already partnered with 2 EHR records and They are like an association of physicians as well as another marketplace for supplements for practitioners. So we have developing the channel partner strategy. And the last part is that I have been building machine learning models for a while, and we know how to spend marketing and reaching direct physicians. Also, part of our model is to collaborate with influencer doctors that are becoming a thing in Latin America and use them as a channel for distribution to our model.
Are you focusing on private or public hospitals?
Private, 100% private physicians.
And haven't they already developed any kind of software? Because I'm from Argentina and good hospital has their own system.
Yes, completely. But it's the same problem as in the US, that these systems are not interoperability between them. And we are 100% sure that in Mexico, the current penetration of technology is 25%. So we have a huge market to conquer there. And the other competitors that could be out there, we discovered, we analyzed, and they are not physician-centric. And we are developing a physician-centric solution with our co-designing partners to make it something that they can really use it and make it faster for them.
Thank you.
Is there anything specific to the Latin American market that you're addressing that isn't addressed by tools that exist in the States now that may or may not do this, but likely address some of the same problems?
I can add to that, but yeah. One thing is, of course, the legal landscape, right? It's so different from the US versus Mexico. Another thing is, in Mexico right now, physicians use a lot WhatsApp. So current solutions in the US are not highly focused on that. And what we're doing is understanding how currently those operations are happening in Latin America, in those small clinics with like physicians that they have their own clinic and they're attending like few patients too. So just trying to continue with the workflow that they currently have and just adding Angy into their workflow. Like, we don't want to change the way they operate right now. We just want to make it more efficient and helping them save time.
You guys have a lot of attractions. What is one thing you're most unsure about? Keep you up at night.
I can add to that. So we have many pillars, right? We introduced that we want to do medical scribing, scheduling, insurance management, all of this. We are starting with medical scribing. So one thing right now is we are ready, based on the PMR that we've done, we know this is a pain point. We know doctors want this, but we are starting to test this in the field. So we want to make sure this is the right way to go by testing it live, because one thing is what people tell you and what physicians are telling us. Another thing is once you go and test it. So we already have our plan B or plan C if this is not the right way to start, and we're already working also on how we're going to develop those MVPs. But I will say that.
What's your theory on why you feel software has not been adopted by these practitioners in Mexico to date? Like, why is there such a disconnect between what's happening when I go to the doctor's office here versus when you go in Mexico?
I can handle. Usually physicians, we are targeting a segment of physician, which is between 33 to 40 years old, which are already trying and accepting this type of solution. Usually the friction happens with people that has been for a while in the market and are not used to the technology. But our initial beachhead is this market, and they are willing to try and accept this technology. That's what we all learned from our primary market research.
Thank you.
Thank you.
Thank you.
Amazing. Thank you so much. Next up, we have Matchpoint. Matchpoint brings a lab to the tennis court, creating a 3D digital twin to optimize performance and prevent injuries.
Tennis
is a game where everything is decided by 1 millimeter. However, unless you're playing at the US Open final, this millimeter is decided by a guess, not a fact. Even in the best competition, the line referee misjudged almost 10% of all the balls. This, as we know because we're a tennis player, creates a huge frustration, and the frustration is omnipresent. To solve this problem, there is the video line calling. The tech already exists, however, it's stuck behind a massive paywall. And we're not even talking about the ATP solutions. In 2026, the only difference between the US Open finalists and the Sunday morning players is, well, the talent. Because the tech, it's already in our pocket. We are match points. 2 iPhones, 2 tripods, 60 seconds, and that's all we need to bring the best video line calling in every court around the world. First, we would put 2 iPhones for the training session, and then we can set up to 8 phones for the full stadium experience. The goal is to reach 99% of accuracy compared to the 90% of accuracy for the human eyes. But Leo, why hasn't anyone done it before?
Well, because it wasn't possible until now. We're building on 2 recent breakthroughs, anticipating a major change in iPhone's role in action sports. First, the Wi-Fi Aware Protocol, released only 4 months ago with iOS 26, that enables Matchpoint to connect instantly and locally multiple iPhones with high precision. Second, our roadmap aligns with the global shutter sensor from Apple that will transform your iPhone in an action sport camera with high precision as well, and makes it capable of tracking high-speed objects like tennis balls. So we are targeting semi-professional and college session trainings to improve our accuracy and to secure the silver certification that is a requirement for official matches. We want to make it available for the 106 million players around the world with an annual growth of 21%. So we're going to lay just between the one phone solution of Swing Vision that lacks of accuracy and a dedicated camera systems that are very expensive. We're going to propose a $90 subscription per month for teams up to 10 players. So we are MIT and Harvard's computer vision engineers. Our industry experience and our passion for the game makes us the ideal team to solve this problem. We're building it on the court alongside to MIT and Harvard head coaches of the women's and men's tennis programs, with which we secured beta training already. So we are Matchpoint, and we believe that every player dedicated to the game deserves a line calling experience. Thank you very much.
You guys talk a lot about kind of replacing the line judges. I'm curious what you see as other features that, as you're kind of capturing all of this data, like what else you can do with it. I assume there's a training angle and upskilling players, but maybe, yeah, talk about kind of the surface area of the product that you see kind of expanding into.
So our, one of the main point of what else we can do with the data is statistics, obviously. It's not the main point of our product, but yeah, it's going to come with it. And most of the point of using line call technology is that we're going to be able, with a bit more of computer vision afterward, to detect who played what ball and to give statistics to the teams as well. So this is the main point, I'd say.
Is the technology, can you transform it to other sports? I can see other sports using this. Is it something that translates easily?
So the main thing we thought about was paddle, because especially in Europe, where we come from, it's a thing. It's huge. The thing is, it's not really the same technology because there's no line calling in paddle. You have walls around the courts. So we're thinking about it. Maybe just implement some video technologies to give statistics. But this is a thing that is already, the market is, there's a lot of competition already in paddle and other sports. So we're thinking about it, but for now, tennis is the main point, the main objective.
You don't do any hardware. You use existing camera sensors. It just has different level, or do you have a plan to make your own hardware?
So the goal is really to make it as simple as possible. So with the phones of everyone, you can actually do it. Of course, we could sell like tripods or this kind of stuff like on the websites, But the main goal is just someone just can take the subscription, and with any phone you can actually develop and have good statistic and line calling.
I don't think that's a question. It's like, why do you think that's better than have a dedicated device?
So the good thing is like there is like the cameras, but it's always bringing the price up, and it's always very expensive. And especially for the cameras, it's always for one court, because there is like other we talk about baseline, and it's like 4,000K per year per court. So it means that even if you have like 4 courts, because like for example in the MIT or Harvard team, they always have like 5 courts playing in the same time. So it's not feasible because the price is way too expensive. It would be possible if you have like 1 court, but they have multiple courts, so it's bringing the like price so expensive that they can't afford it.
Maybe one more for you guys. How do you guys think about total addressable market here? I saw some of the top-down numbers, but I'm just thinking about like how many teams do you think conceivably would be willing to pay for this? And then also maybe second question is how much do you think they'd be willing to pay for this?
Yeah, so basically there is like 1,800 university team in America. And then there is like 130,000 in total for the semi-professional team. So basically at the beginning we would focus on all the university team because we have all this network thanks to the MIT and Harvard coach. And then the goal would be to address all these 130,000 club in the later stage.
This is the use case that you decide to go with. Did you start with like a larger use cases for this technology?
So basically, we really built it with the coaches. So we arrived with the coaches, and we just like our initial idea was totally different from this one because we really asked them what do you need, and then we kind of like iterate by testing it and building with the court, with the players, like if they liked it or not, what did they like, what did they use the most, and then we just iterate with this.
So I've never held a tennis racket in my life, so I don't know what I'm talking about.
It's good.
You know, we're seeing this happen with baseball now, where the umpire is now having a call check with, the AI or whatever. Don't you think at like the academic elite, non-tour professional perspective, folks would rather be mad at a human versus a system that is somewhere in the 90% correct? Because I feel like from the trust perspective, it's a lot easier to yell at a human ref saying that was a bullshit call versus believing in a tech getting it right.
I think that's also why the certification is here. And there is like the silver certification that is proving that there is like multiple steps for the silver certification. And if you have actually the certification, it means that you have more than 99% of accuracy, and it's way more than actually the human eyes. So they could be mad at the referee, but at the end, like if you say that this is like the tool that we're using and it's way more accurate than the human eyes, I agree they wouldn't be able to like just shout at the computer or the iPhone, but
the referee is still going to be here, so it's okay. They can still argue with someone. Thank you very much.
Thank you. Next up, we have NeuralPhysics. NeuralPhysics is building foundation AI models for physics, simulation, and engineering design to deliver real-time predictions.
All right. Hello, everyone. We are NeuralPhysics, and we are building foundation physics model. So the pinpoint we are going to tackle is engineering simulation today is slow and expensive. And we are going to accelerate the simulation with AI by building foundation physics model. So this is our team. We have Mo, who is MIT AI and physics PhD. I'm Qian, former MIT Mackey postdoc. And we all have engineering and industry experience at Toyota, Siemens, and Meta. And we also have two amazing advisors, Professor Angela from TU Munich and Professor Fayaz Ahmad from MIT Mackey. So with our background, we are not building LLM wrapper. So we are building a physics native foundation model from the ground up, including both data and model architecture. So we have the data mode, so we have our own unique technique to build large-scale simulation data. So we call that Driver Nights++, the largest aerodynamic simulation dataset for vehicle design by far, including 8,000 different designs. So it is our honor this work has been highlighted by MIT News in 2024. And we also built our large-scale geometric deep learning model with the 40 terabyte data and achieve the accuracy over 98%. And more importantly, it is thousands of times faster than traditional simulation method. So turning the simulation time from hours to seconds is going to be a game changer. So we turn the simulation from bottleneck to a real-time design tool. And let me use the automotive industry as one example to explain why. So typically, it takes 3 to 5 years to build and design a car. And the total R&D cost on simulation is roughly $500 million. If we can compress the total design cycle within 1 month, we can free up millions of dollars in R&D cost. And more importantly, the manufacturers can bring their car into the market 2 or 3 years earlier. And automotive industry is super competitive. If you can launch your car even 1 year earlier, it means billions of dollars revenue. So even though the adoption of AI in engineering simulation is still at pretty early stage, we already get revenue. So we work with MIT TLO office, and we get over 25 paid customers. And last year, we get over $240K revenue through the dataset and the model. Our customers including NVIDIA, Microsoft, Google, Siemens, and Toyota. So we are expanding our work and include more physics such as structure mechanics, aerospace simulation, and chip design for semiconductor to make our model smarter and acquire more market share. So yeah, we are NeuralPhysics and we are building foundation physics model.
So what would be the typical learning curve for someone that was maybe used to using some of the traditional like finite element analysis tools to start using your tools?
We already see the adoption from this industry software giants. They adopt that as a more like experiments, but they never use that for their real products. And we are also co-piloting with a design company to use the AI method in their design pipeline. So it is still at pretty early stage. Yeah.
Where do you see this goes? I mean, you have customers that are the traditional using the FEA one. You have your potential, like you're trying to kill like ANSYS that's using it. And you have this like big names that's gonna include the whole world, like NVIDIA, into their pocket. But like, where do you think, do you want to be another ANSYS? Like, what's?
Yeah, we want to build a AGI for physical world because those companies, we didn't try to start commercialize at the very beginning. So we tried to just build the research and open source the data sets and the model. But we got some inquiry from those companies. So they don't have this super large scale data sets. So they become the customer and they buy that through the MIT Technical License Office. So in the future, we want to, because here is the comparison between us and all those companies. Like we compare from two axes, data and model. So for example, for data availability, so those companies are lack of data set to train the model. And also for the model, most of the traditional CAE companies, so they have lots of people know how to develop the traditional method, but they don't have AI knowledge. So we try to be here, like including both data and model, and let the scaling up play more important role.
Do you see your biggest challenges more technical or commercial?
By far, I feel it's commercial because, like I just mentioned here, we try to expand to more physics. And when we build the first Neural++ dataset, it's all supported by MIT, like software, the license for the software, and also the CPU hours. But we just made some simple calculation. If we scale the dataset 10 times larger, it costs roughly like $200K for the AWS or Google Cloud credits. So right now, I feel we are more limited by the commercial side because we try to get more physics in our model.
Can you chat a little bit about the training data? And I wasn't fully clear the 40 terabytes you mentioned. So this is, what specifically is that and how were you able to get your hands on it?
So this paper was, actually this data set was firstly the academic asset. We open source that. We charge for commercial usage. And for this car data sets, we consider different design type like SUV. And we have all the aerodynamic simulation data like the surface pressure, and also for the entire car, we have the drag coefficient to scale the aerodynamic performance. So we include everything, and also the 3D flow field like this. So that's why we can have a model like this one to predict the 3D flow field. So this is a simulation data, and this is the AI prediction. Yeah.
What's the trade-off between the 12 seconds and the countless hours? Is it what you're getting to as it relates to cost, or is there a fidelity loss between the traditional method and yours? And I'm assuming this is on, because of NVIDIA, this is on GPUs.
Yep.
So as it scales, it's probably going to get really expensive unless you find ways to compress that down. And as you compress down, how does that come back to fidelity?
Yeah, that's a very good question. So I feel the trade-off of speed is generalizability. Because, for example, if we have some new type of car, like Tesla Cybertruck or like the Formula One car, we don't have that in our data sets. So we can predict, but we cannot trust the prediction accuracy because it is a completely new car. So I feel this is the trade-off of the prediction accuracy. So that's why we want to make the data set larger. And another trade-off I feel from this is because if you only run one case, you take 30 hours, and we build a very huge data set, and we train the model. It takes lots of efforts. I feel that's another trade-off because we need to generate the data sets, and we also need to train the model, and then we can get this speed up.
Thank you so much.
Yep. Thank you.
Next up, we have Rindler. Rindler is a reliability as a service middleware that bridges the gap between AI agents and e-commerce by translating websites into clean, deterministic APIs. Please give a hand to Rindler.
Hi, I'm Michael, co-founder of Rindler. We are the infrastructure layer that allows agents to successfully buy, book, and browse on any e-commerce site. We are a team of 2 MIT seniors studying computer science. Arthur's done a lot of research at MIT's CS and AI laboratory. I've done work in machine learning at Roblox, and I've also served as vice president of the Sloan Business Club. The problem that we're tackling is that the web was built for humans and not agents. This means that agents are really struggling to transact on a lot of these different sites. And if companies want to go and support the agentic traffic, they have to navigate a sea of different competing protocols. These are all really emerging. It's hard to say which one's going to win. And overall, successfully handling this is a huge maintenance nightmare. That is where Rindler comes in. We are a model agnostic and protocol agnostic middleware layer. What this means is that when a site uses Rindler, they do not need to rewrite their code base. They do not need to gamble on what individual AI protocol is going to win. Instead, we abstract that all away as an infrastructure layer that agents can then interact with more deterministically. This means that they're able to go and capture this massive wave of agentic commerce in a much more hassle-free manner. The way that we do this is that we first pre-process the site through a proprietary ingest engine. We understand how the site works, and then we go and set up some mappings for how to properly traverse it. Then, as agents are running through it, we continuously run telemetry and fallback strategies to monitor how it's doing, and then have a self-healing loop set up so that we can continue to offer this deterministic execution promise.
We benchmark the open source browser use agent on a potential pilot partner's e-commerce website. And we found that with Rindler, the agent performed 4 times faster at less than a quarter of the cost. We can use these metrics as a proxy for how difficult it is for the agent to navigate on the website. If it's easier for the agent to navigate, the agent is less likely to give up on that website, making your business a market leader in agentic commerce. Our initial beachhead is a $630 million ARR opportunity. We're targeting 50 global marketplaces and 1,000 mid-market retailers who are actively losing out AI-driven revenue because they are not prepared for agentic traffic. We offer a no-cost integration and a 15 cents charge per successful transaction. For e-commerce sites, this is a zero-risk way of capturing net new AI-driven revenue that they're currently leaving on the table. Currently, we're defining our alpha pilot with a multi-billion-dollar e-commerce site to deploy our middleware on live transaction flows. Once we validate our reliability at scale with our Q2 design partners, we'll raise a seed round in Q3, targeting a $1 million ARR by the end of the year. If you know a CTO or a VP of engineering losing sleep over their AI traffic strategy, we have the infrastructure to solve their problem. We just need the introduction. Thank you.
Is it technical edge for you guys when we think of like legacy players in this space like Bloomreach and others who spend a lot of time optimizing e-commerce websites? Is that where the PhDs come into play, that you're going to be able to do this better, or is this first mover?
So that's a great question. So actually, there are a couple of solutions that companies are currently considering. For example, a company could build their own in-house solution to their specific website. The problem with that is that that quickly becomes a maintenance nightmare because they have to worry about the competing protocols that are constantly evolving and constantly changing. OpenAI has a different protocol. Google just released a new protocol. Anthropic's MCP is currently dominating. So for a major enterprise, this seems like a very unstable place to start developing their own in-house protocols. Another avenue they can take is partner with a specific brand, say like Instacart partners with OpenAI. That would lock Instacart into the ecosystem of OpenAI, and then that would make it difficult for them to open up to different AI agents that visit their site.
Do you see this as kind of more of a B2C solution, or is this could this be expanded to kind of a B2B supply chain type solution where companies can use these tools to interact with one another and have automated supply chain technology?
Yeah, so this is definitely a B2B solution. So we are selling to businesses so to make their website more attractive to customers who are using agents. So for example, currently businesses spend a lot of money optimizing their websites so that people will want to be on their websites more often. In a similar sense, we're optimizing their websites for agents so that agents will want to be on their website more often.
So when you say when I was saying B2B, I'm talking about your customers selling to other businesses.
Oh, okay.
As opposed to, so like if I'm a parts manufacturer and I sell to the automotive industry, would I be able to use these tools to kind of optimize the interaction between myself and my suppliers, for example?
Yeah, it's there's a lot of potential in this space, I think, for what agents can deliver on. Really the problem is that there's a lot of things to tackle. And so we're starting off initially in this idea of like just web agents interacting with sites, because we think that's one of the most immediate pain points that we're gonna see. I think in the long horizon, however, I mean, there's a lot of different opportunities. You could focus more in how do businesses communicate within each other? How do they even communicate just internally with like more confidential stuff? Or even like a long run horizon of just like in web by itself, right? There's so many different types of website offerings that we could see agents interacting with. So like there's a lot of different potential things, but right now we're starting off with like e-commerce navigation on the web.
You have like two metrics to show. One is how fast it is, and one is how much cost saving. But I think for the consumer, I think the accuracy of getting what I want is more important. If I want a very nice Halloween costume using yours versus I just Google, I think the result should be more important than this. How do you validate that? Yeah. How do you know if it's a problem of the agent or the problem of your middleware?
Yeah, that's what makes success a more difficult metric, but it's still a very important one. I think that the way that we validate it is that we are constantly just like messing around with different web agents to see what the space is like and how they're performing on our different targeted sites. Like for example, like right now I can tell you that the best models that we're seeing that are open source and available are operating at around 30% success rates on these sites for complex flows. However, like whenever we're running it through our middleware, we're able to reduce this, or I guess raise this probability up to 70%. And even the types of failures that we are noticing completely change as well. So stuff like the main issue with a lot of these agents is like context in a sense, and having to rethink every single step. So maybe in the past an agent has to stop at every point of trying to input an address field correctly, and it's already lost like 30 seconds into it. Versus if we found a way to just make that really straightforward and really easy, it's able to get past that step and then accurately focus on the tasks at hand. So I guess to cut it to TLDR is like, right now, we do see a lot of like big improvements for agents. We want to get that up to like a 99% like reliability rate. And I think once agents generally get strong enough in reasoning that they can all kind of hit this metric more or less, then the question is, what's the ease of usage of these agents, which is where like the speed and the cost come in.
Thank you so much. Next up, we have Kinsu Capital. Kinsu Capital builds compliance infrastructure that makes payroll payments possible for skilled remote workers blocked by banking restrictions. Please give a round of applause to Kinsu Capital.
Landing a job is difficult. Hiring is difficult. Getting paid for the work that you've already done should be easy. But for a lot of people, it's not. I'd like you to meet my sister, Ragad. She's a successful serial entrepreneur who exited one company and was fundraising for her next one when she was forced to seek asylum in the Netherlands. She took 6 months, got her work authorization, and landed a remote job for a Saudi company as a senior manager. But the company couldn't pay her. And this went on until she raked up over $100,000 in locked earnings. And she's not the only one. There are 117 million displaced people around the world whose documentations are simply not standard enough for the financial institutions right now. This comes in at the rate that all the companies hiring these people have to find workarounds. And the workarounds are expensive, take a lot of time, and come at a 40 to 60% failure rate. And this is what Kinsu Capital is trying to solve. Kinsu Capital sits in the middle between the employer and the employee because we believe that stablecoins could be the solution. Employers initiate payment in their local currency. Our regulated custodian converts it to stablecoins, and then through stablecoin rails, it arrives at a local off-ramp who pays the employee. The employee then decides to choose to hold it in a stablecoin or cash it out in their local currency. The payroll space is very crowded. Global platforms like Deal and Remote that you know of are simply too big to solve for this population. And there are obviously the transfer rails who are not built for B2B businesses models. And honestly, nobody should be paying their employees with MoneyGram. It's a market opportunity that expands with volume. We start with 5 routing to pay employees. From there, we can prove the compliance and the routing playbook. Once we get to 50, then we're looking at $10 billion to $30 billion of volume from payroll flowing through Kinsu Capital. And our rate is 2 to 3% transaction per transaction. We would be making close to $900 million in recurring revenue. We already have 2 pilots committed, and we have an angel investor who's backing us, because this is a real problem that a lot of people face. Why me? Because I have the local network. I've worked for Gaza Sky Geeks, which unlocks already 50 million employers facing this problem, and over 17,000 tech people working remotely. I also have worked in M&A, so I have 6 years of experience working with partner-heavy and cross-border transactions, and I'm very comfortable with that. I have legal and stablecoin infrastructure advisors working with me at the moment, and I'm hiring for a technical engineer. With Kinsu Capital, we're trying to repair what others left broken, and we would love for you to join us. Thank you.
Thanks. I'd love to dig into the employer compliance responsibility. Part of what you're saying is like actually the movement of funds, which I think I understand the use case around stablecoins, but I guess as an employer, if I'm employing somebody in OFAC sanctioned, like, don't I take a lot of responsibility for doing that in the first place? So help me kind of understand how we would even enter these employment agreements in the first place, where we have employees maybe in countries where that are fully sanctioned.
Absolutely. This is exactly the problem that we're trying to solve for. But I'm trying to tackle it in phases to gain a stronger foothold. I'm working with employers who have already went through KYC and AML and all the compliance issues for the people they are hiring from these regions. And these people are not in the sanctioned areas at the moment. They are elsewhere. They're working remotely. They might be in the Netherlands. They might be somewhere in Europe, and they have the legal work authorization, and they're fully authorized to work. So there's no compliance issues there. For the next step for Kinsu Capital, it is to actually tackle KYC and AML for employers, and we're doing that through a network of local partners and companies that are specifically focused on restricted regions and people from restrictions or sanctions areas to how to navigate with the kind of documentation that they have.
So you currently have a banking partner, a bank that you're working with?
We are in talks right now with the local partners and also the custodian local regulator.
Should we think about this as being all general work or applied? Because I see the use of the term professionals. So is this tech labor, or how should we think about that?
This is purely tech labor. So think of engineers, designers, or whoever who's able to do their work remotely, because that's the most enabler. Yes.
Got it. Is it fair to say then that some of this feels like buying an ETF on the tech labor market in these regions, and if it's going well, it goes well, or if there's automation or a pullback, then it doesn't go well?
I don't believe that the tech market is going to disappear if there is automation. I think it's always going to evolve into something different. So I believe that there will always.
That is a completely unfair question for me to ask, but more so about this region, I guess. Yeah.
Yeah. No, at this region, I have seen firsthand, as having worked in the region, with the evolution of how the automation is happening for a lot of businesses. The training and upskilling programs have also evolved to enable people to find multiple jobs that might be different than what they have started with. So I'm working with regions that are known to be resilient and always finding a way to find jobs. So I believe that it's only going to grow with scale rather than shrink in size.
You mentioned you're looking for a technical partner. Were you able to build the MVP anyway?
I vibe coded an MVP, that's the question, but it's not like at a point where I would be comfortable sharing it. And this is why I would love to have a founding engineer.
What keeps you up at night related to this business?
Honestly, the regulations around stablecoins. I've done a lot of market research to find my beachhead, and a lot of the countries that I'm working with right now, some of them straight up ban stablecoin, but there's a lot of talks about all these bans being lifted once the country is like more aware of the benefits. So I guess what keeps me up at night is if it takes longer than I anticipate. But there's always other corridors that I'm working with, and this is why I've moved on from multiple countries.
Thank you so much. Up next, we have our last team, Uplift Micro Home. Uplift Micro Home is bringing us housing on demand. Please give a round of applause for Uplift Micro Home.
Last year, my city was struck by the devastating Palisades fire. SpaceX deployed me to help get first responders connected to Starlink. The experience shook me. In a matter of hours, entire families' belongings were decimated. It left them wondering where to go and how to get back to what life was like before. 3.3 million Americans are displaced every year in the US. If they're lucky, they go out of state with their friends and family. If they're not so lucky, they could end up in a homeless shelter. Bottom line, everybody, America lacks private, affordable, and dignified living after a disaster. 4 months later, FEMA arrives. Shitty homes in a dirt lot hundreds of miles away. Why does this take so long? 3 reasons. The products today require power and water utilities to be online on-site. They have extensive foundation preparation requirements, and their transportation logistics are extremely inefficient. And as a result, less than 1% of survivors actually receive a physical home. The rest get a check and are told to go figure it out. DHS audited FEMA, and they had only one recommendation in the report: provide a housing alternative that allows survivors to be close to home and cost competitive. And that is what we are making. We are building a new world where we can provide housing on demand for anyone, anywhere, at any time.
The Uplift Micro Home is a highly engineered temporary housing unit designed to address the 3 bottlenecks of current disaster housing. The Micro Home is off-grid capable, eliminating the requirement for power and water utility hookups. The Micro Home's base is designed so that it can be deployed on uneven terrain with minimal foundation preparation. And the Micro Home's weight distribution allows it to be picked up and moved around with the ubiquitous forklift, dramatically simplifying delivery, installation, and deactivation. And we're designing Micro Home with automotive principles that unlock manufacturing at scale. And by purpose building our feature set for our stakeholders, we achieve a price similar to that of the cheapest travel trailer while delivering housing in just hours rather than months. The problem we're solving is huge. Federal disaster spend on this problem is $13 billion per year. And this has tripled since 2005. This is just the beginning. There are millions of more people who need transitional and temporary housing. Seasonal workers, rural construction projects like AI data centers, and of course, homelessness.
My name is Charlie Nitschom. I spent 5 years at SpaceX, where I was designing and scaling the mass production required for the Starlink network. Trevor spent 5 years at Tesla, scaling vehicle electronics across the entire product portfolio. We have the building and scaling experience this problem demands. Let's end disaster homelessness. Thank you.
So I was in the Pacific Palisades that day, and a family member lost his home in Altadena, so this is a real problem. Have you actually built, like, do these things physically, like I was hoping to see one
Totally.
wheeled in here.
If we get invited to the May, it'll be here. We're building the first livable prototype right now. I was at the shop this morning. We built a half-size prototype because I wanted to get a feel of steel construction, wood. I haven't built something that large. But we're building a full prototype over the next month, and we're going to be sharing our progress on Instagram, of course.
And who do you see as the actual customer here? Who's gonna write the check? Is it the government? Is it the insurance companies?
Yeah, it's a little scary. It is government to start. That's going to be our primary customer. The answer would have been changed 10 years ago. I probably would have said FEMA 10 years ago, but it's not the case anymore. We see very direct evidence that states and local municipalities, the citizens themselves, the elected officials, do not trust FEMA to show up. They arrive 4 months later. We talked to someone who's been rebuilding homes after Hurricane Helene for 16 months, hasn't even seen a FEMA official to help. They don't believe that they'll be there. States and local municipalities are now bringing the problem into their own hands. They're looking for products. And of course, spending is less, but that's our in. We're producing a product that is going to be of higher quality than the status quo for cheaper, much cheaper. People will be calling us.
Well, why are you so confident you're going to be cheaper? You're building everything here. Like why? How?
It's actually because the competition is not addressing this problem whatsoever. They're buying travel trailers for weekend trips and manufactured homes which are for permanent housing. And so those systems, those options require extensive installation costs, we don't have that. This whole thing is designed to eliminate labor on site and the requirement for infrastructure. And so all of the features that we have is specifically designed to reduce the final leg cost.
Do you guys view yourselves as a manufacturer of micro homes or some kind of more vertically integrated service that is actually standing up these homes after a disaster?
Yeah, primary manufacturing, and of course, getting it to the site when they need it. But our specialty would be manufacturing and manufacturing at scale. I kind of see like production in 3 stages, and I think it's typical. Like last stage, hopefully you'll visit us 5 and 10 years. We're building these like cars, which we haven't really had in the housing market, and this we can do with. First stage will be artisanal, just in a shop. Second stage will be a blend of both. We'll do low-hanging fruit for tooling, low-hanging fruit for injection molding, casting, whatever makes sense. But yeah, we will be the manufacturer for these.
And then if you sell a bunch of units to a customer, I guess I'm just trying to think through, like, how do you scale manufacturing and then customer, it could be state or government, buys a ton of these. But a lot of them might just like sit unused for a while. So I guess how do you think about like ongoing demand versus like manufacturing here?
We actually had an interesting business model that we started with, and I think it's better for the future of our business. In the beginning, we just need to sell these. We need a negative cash conversion cycle. We can't own the assets ourselves. But in the future, the plan would actually be to own all the assets and utilize them per disaster. And we can actually do arbitrage where we know how many disasters are going to be coming. It's very predictable. The number is increasing. And we can allocate them based on where they're needed. But I think that like subscription model is too complicated for starting the business.
If the government was better at forward-looking versus reactionary, we would have better transportation, better healthcare, pretty much better everything. And so like the presentation was awesome, but I'm trying to see the human element here, which is one of the reasons why these disasters cost so much is you quickly hire a service provider versus own the equipment outright. So where in the budget will this come out of? And when municipalities are selling off their water systems and their good assets just to operate in the black, how are they going to justify this upfront expense to their constituents?
Well, I think the reality is they already are spending more on a solution that's less applicable to this problem. And so actually this is specifically why we are starting with disasters as our opening market. The government moat is actually really important, and I think a lot of people talk about moats as why it's going to help them, but at the end of the day, you have to overcome that moat too. And so by starting with disasters, we catch governments when they need to act quickly, and they're like, oh, God, I just need something. And we are here to offer exactly that, which no other company is making a product for. And that actually is how we get into the moat and then hold it.
Awesome. Thank you so much.
Thank you.
So that's all of our competitors. Let's give another round of applause for every single one of them who competed today. So voting for audience choice is now open, and you'll have until 8:30 p.m. to vote. If you're in the room, please scan the QR code that will be on the screen. Now you can scan the QR code that's on the screen and cast your vote using the unique voting code that you received once you entered into the auditorium. We also invite you for a brief reception outside of the auditorium where our team has set up food for those who have not already had it, and you're welcome to chat with our competitors, ask them any of the burning questions that you have. We will then call you back in around 8:30 to 8:40 to hear the final votes. We'll invite everyone outside, and we'll see you back here at 8:40 for the announcement of all of the awards.
Hello? Oh, perfect. Please start heading back into the room. We're soon going to announce the winners. Thank you. Are you ready for your audience choice awards? Yeah, it's upstairs.
Handshake with the winners.
Oh, yes, handshake with the winner. I'm doing only the first place, so thank God. I will get to see you two go beforehand.
Great. Great, awesome. I love that for myself. Wait, do you want to make an announcement right now saying please remember not to bring anything? No, really gracious. Crazy.
I'm not
the
sorry.
same.
I'm
the exact same points.
No, you're good. That's what you got? I think most likely, I was like most likely to recognize a face I got for that. Oh. Yeah, that was my thing, most likely to recognize a face. True, yeah. Okay. Thank you, everyone. Welcome back. For all the people who are coming in, please feel free to sit down. We are going to announce the winners. First, yeah. Are all the competitors in the room? Yes, 1, 2, 3, 4, 5, yeah. Is Mendai Health still in the room? Oh, yes, they are. Okay, perfect.
Okay, so we hope you all enjoyed the brief reception, and we are excited to bring our program to its exciting conclusion. As a reminder, tonight we'll be presenting 4 different awards. The first is the Audience Choice Award, which you've just selected, and they will be receiving $1,000. The third place winner will also be receiving $1,000. The second place winner will be receiving $3,000, and then the grand prize for the first place winner is $10,000. The 100K competition is driven by student initiative, and as you clearly saw tonight, a lot of passion. Thank you all for coming tonight and spending this evening with us. We are now super excited to announce this year's Accelerate winners and close this very special evening. So, without further ado, the Audience Choice winner who will be receiving $1,000 is Angy. Congratulations.
More in the center. Checks are yours.
Okay, and for our third place winner, it's, drumroll please, NeuralPhysics. Congratulations.
Wait, NeuralPhysics, I think come back. The photographer was trying to take a picture. Sorry.
I got one, but if you want, it's a little tilted. Yeah, be sure to bend Leo, and then bend the check. Vertically. And then pick out the bit. Exactly. Superhero, the best one.
And for our runner-up, it's drumroll please, Cerberus AI. Please come up, Cerberus AI. Congratulations. Great job, y'all.
Amazing. And finally, for our first place, the Danny Lewin Grand Prize Award winner is, drumroll please, Uplift Micro Home. Woo! Congratulations. Congratulations, of course.
Let's go.
Woo! Amazing. Thank you again. Thank you again, everyone, for joining us this evening and making it a night to remember. We would like to first thank our sponsors, our incredible panel of judges. So huge round of applause for our judges, please. Thank you for dedicating your time and support to coming and judging these amazing ventures. Our organizing team, a huge round of applause for them for putting on this event. It is months of preparation, so thank you for our amazing team. Amazing. MIT AV and Video Services, who are amazing, who set us all up and got us on the live stream, so thank you. We'll be able to watch this in perpetuity. And then we look forward to seeing you on May 12th for our final competition launch, so please be there. And where the grand prize winner will be receiving $100K, so it'll be the last competition for this year. So thank you so much. Have a wonderful night, and we hope to see you on May 12th. Oh, yes. If you have any food or beverages that you brought into this room, please take plates and all food outside. We are not allowed food in this room, theoretically, so please bring all food and plates outside. Thank you.